Send a message to the unborn child. Keep your eyes open for a while. In a box, high up on the shelf, left for you, no one else. There's a piece of puzzle known as life, wrapped in guilt, sealed up tight. Hello, Dr. James Bogash with Modern Health Myths, coming to you today a little bit more, not talking about COVID today. There's always a tremendous amount of research going on in a lot of other topics outside of COVID. It's just that most of it seems to be COVID related that is of interest today. But today I'm going to talk a little bit about acute and chronic, or treatment of acute and chronic injuries, in this specific case the elbow, and how we manage it in our office in a research study looking at a different way to treat them that is probably one of the most effective. So kind of get started on there. And our office, I've been in practice 23 years now. We've always had a very heavy focus on treating the soft tissues as well as adjusting. I've always felt that when you combine the two, you get the best outcomes. But there's reasons for that. And when I say soft tissues, a lot of times people don't really understand. We're talking about the muscles, the ligaments, the tendons, but the fascia is one of the tissues that's the most hard to describe. Even most spell checks don't like using the word fascia, so it makes it even harder to describe it. But the best thing I get with, the best description I give with patients is bubble gum. We know we can chew on it and it's nice and pliable and it can stretch and it's moist and it holds stuff together, but then all of a sudden you put a piece of ice in your mouth and all of a sudden it's hard and you have to chew it to get it warmed up again. So that's what happens after, or my description of what happens to the fascia after an acute injury. A chronic injury is more like the gum you found under the chair. I'm sure if you chew it long enough, it's going to get warm and pliable again, but it's going to take a lot more work for that piece of gum you found under the chair than the piece of gum that you just chewed along with some ice for a minute or so. But fascia is probably one of the most critical players when it comes to acute and chronic pain. It's probably also one of the one of the least appreciated tissues when it comes to managing it. Almost everything that we do in treating injuries doesn't have to do with the fascia. So the one tissue that's probably the most critical is the one thing that most people don't address. It integrates with everything, not just the musculoskeletal level, but also right down to our organs. Like the fascia goes down in between the individual cells. So it's really a huge component of every part of what we are. But it does have an incredible, there's some suggestion that it helps with viscera, or plays a role in viscera, so our organs, and so liver function, our stomach function, certainly a lot of chronic pelvic pain, but really plays a role in musculoskeletal injuries and conditions. So fascia orchestrates all movement. So to think that we learn that muscles move joints, but that's not really the case. Muscles increase tension in fascia, which then moves a joint. But a large chunk of our feedback that we get is from the fascia. We have areas of the fascia that increased, so it makes sense that we're fascial planes, so like flexion and extension of a joint, that those planes may cross, and where they cross, the body decided it needed a lot more feedback. So sure enough, if you looked at those areas where those planes cross under a microscope, you would find that there are increased density of certain receptors in there, and that is designed to give better feedback to the joint so that it moves correctly, the joint and the brain. So it's believed that when an acute injury happens, and Lord knows, being in the martial arts, I've had my share of them over the decades, and when that happens, the body locks down an area initially by thickening the fascia. So the fascia becomes less viscous, kind of like my ice in the bubble gum scenario. While this is great in the short term, not so much if it perpetuates. And it's one of the reasons why I think we have such an issue with chronic pain is that we mismanage the acute side of things. And that means that we have tendency to use ice for too long. We immobilize when careful movement initially is important. And we take anti-inflammatories. For myself, I haven't taken an anti-inflammatory in 30 years, if not longer, despite radial head dislocation, thumb dislocations, low back pain, extensor tendon ruptures, because I know how much they interfere with normal healing. Now we know that anybody who has a surgery, an orthopedic surgery, they tell them to avoid anti-inflammatories for at least 30 days. So if it bothered it after surgery, what about before? It certainly makes sense. But it's one of the reasons I think we have so many chronic pain cases because we mismanage the acute and we allow it to become chronic. So what ends up happening with time is those dense areas of the fascia don't go away if we don't treat them appropriately and quickly. They just become more permanent, and now the body adapts. So now a joint may not hurt anymore because the body's adapted, but it can only adapt for so long until it can't. And that's when things start falling apart. Because understanding that if we have an area, let's take the elbow, if there's an injury to one side of the elbow, it's going to affect the way that joint moves. And while we may be able to adapt for a short time, what happens when we get the next injury? We may not be able to adapt. And so your current pain may be a result of accumulation, or is likely the result of accumulation of decades of injuries that have piled atop one another and were never appropriately treated. This is why I feel that every chronic pain treatment has to include a strong approach to the soft tissues. The problem there is that very few people really know how to truly, competently treat the soft tissues. I know I've been doing this for 25 years, there's still lots to learn, but the reality is most people don't focus on that type of approach. That means that things like your run-of-the-mill massage, there are some top-notch massage therapists that are a different story. Exercising alone, that means just exercising a joint doesn't do anything to change these dense areas of the fascia. Adjusting, as a chiropractor, obviously it's a big tool that a lot of my colleagues use, but adjusting by itself is not going to fix a problem. They're only likely to make temporary changes and not fix things in the long run. Acupuncture, dry needling is the hot new thing, but really I think that those techniques are, while you could argue that they're treating these dense areas of the fascia, they're not enough to really make long-term changes. So that's why I always say, like, simple treatments in the first couple days of an injury can be effective. I've had patients that came in and some type of pain just started, and we work on it, it's gone in 30 seconds, and it never comes back. Now, if they just let that go, that's the kind of thing that sets up for future problems. If something is more chronic, techniques like Graston, which we've done for a long time in our office, fascial manipulation, a specific technique called FM, acoustic therapy. We've had a couple of times we've demoed an acoustic therapy. It's a device that uses a shock wave, similar to some of the massage guns that are out there, but way more technically advanced and able to get much more fine-tuned, but it's not a comfortable treatment. Clearly, though, fascial manipulation, or FM, is leading the research. This is based out of a family of physicians and researchers out of Italy called the Stecco family, and they clearly lead the charge when it comes to understanding how much the fascia plays a role in chronic conditions. So if we're looking back, there's been some research. This is an interesting one that looked at a small group of patients with elbow pain, and the difference was they used an MRI, but the MRI is tuned differently to look at water content within tissues. So not a typical MRI looking at, wow, do we have arthritis in the joint? Is there an injury? Is there a tear? It looked at how water, so it was looking for these dense areas of the fascia. And they found that after specific treatment on specific areas, that these tissues had changed and become more pliable. So kind of like that gum with the ice in it, we chew it and it starts to warm up and becomes more pliable. That's what happened with the MRI. So that the study would suggest that specific treatment in specific areas loosen up the dense areas in the fascia. Couple things to understand is that this FM isn't just about the treatments, about diagnosis. It's about looking at fascia of the planes of movement and how they're affected and restricted, and then treating specific points where those planes intersect. And that largely, it doesn't just include the elbow, it includes the entire upper extremity, can have a lot to do, and there's a lot of people that understand this a lot more than I do and are incredibly competent clinicians. So those are some things important to remember when it comes to treating pain. One of these days I think I will do just a short video on what to do when you have an acute injury and different things that I personally recommend for patients to have at home so that they don't need to see me and so that acute injury does not become chronic. Other than that, I will post a link to, I'll put a couple of my videos on there about treatment with Graston, as well as this particular research study on fascial manipulation and treatment of chronic elbow pain. And as always, please like, share this video, and subscribe to the channel.